Let me know when you're ready.
Ready.
Okay, go and start filming. I got you, battle buddy. Listen, pressure on the wound. Pulling out. Combat guys. Oh, this ain't turning out good. All right, sticking my finger in there as close as I can towards the heart. Making a little ball there. Sweeping out the, shoving it back in there. Apply pressure, finger over finger. Finger over finger.
Is that my rep?
Finger over finger. Over finger.
Stop the bleed, I'm dead.
Pushing. Finger over finger.
What did they say about, I'm not a big fan of sure. What did they say about just
I did
not bleeding?
What's fake? When you take my blood over, well, that's right. It's under the head. It's just keeping it dry.
Because I knew they were reaching, they told me that.
Finger over finger. Shove it in there.
You think this was more everywhere? It'd be good saturated before you get that effect is already activated.
Finger over finger. Finger over finger. Shove it in there as deep as you can. Hang in there, buddy. Hang in there, battle buddy.
I didn't know. I kept squeezing. I was like, oh shit, it's loose. I was like, hey Ben, take it.
I mean, I'm still pumping it. It's not coming out.
Shoving. Still packing. 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 Once I got as much as I can in there, if it's good enough, I'm going to apply pressure for 2 to 3 minutes. Once I apply pressure for 2 to 3 minutes, I'm going to apply a field dressing. Slapping that bad boy on there. There's only field drainage. Wrap it around. Back over.
I think we need more blood.
Pressure back over. Wrap it over. 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 I'm going to twist it on top of it. Apply additional pressure. Twist again. Keep wrapping. Keep wrapping. Hang in there, battle buddy.
That gauze on the ground, right? It'll start sucking up. It'll start reacting to the blood on the ground.
Keep wrapping. And then seal it off. Apply different pressure. Hang in there, battle buddy. Reassess my march of my massive hemorrhaging, airway, respiratory, circulation, hypothermia, triple hypothermia, and prepare to evacuate. Cool.